Hi, my name is Natasha Robinson. I'm going to perform my final head to toe assessment. I'm going to wash my hands, provide privacy for the patient, introduce myself. Hi, my name is Natasha. I'm going to be a nurse practitioner today. And what's your name?
Samantha Cerny.
Patient has arrived to the clinic for just a yearly physical. So first, vital signs, height and weight and BMI all obtained. Everything's within normal limits. Past medical and surgical history, and allergies reviewed, and current medications. So looking at the patient, she's maintaining good posture, eye contact throughout the exam, no signs of distress. She's alert and oriented ×3. So first, I'm going to look at her face. Everything looks well symmetric. Checks her nail beds. It has good color. Capillary refills less than 3 seconds. No clubbing. And then I'm going to just palpate your scalp. Are you having any tenderness?
No.
Hair is evenly distributed. And then I'm going to palpate, your frontal sinuses. Are you having any tenderness?
No.
Your maxillary sinuses?
No.
Okay. Your facial bones, any tenderness?
No.
Alright. Everything's within normal limits. And now I'm going to assess your TMJ joint. Can you open and close? No clicking observed. Everything's moving freely. So then I'm gonna test cranial nerves 5 and 7. If you can raise your eyebrows, puff out your cheeks, stick out your tongue. Cranial nerves 5 and 7 are intact. Then I'm gonna test cranial nerve 5 for sensation. Let me know when you're feeling my touch.
Yes. 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 Yes.
Cranial 5 and 7 are intact. So next thing I'm gonna do, I'm gonna look at your eyes, which are symmetric. Look at your sclera, they're nice and white. Check your conjunctiva, which is pink, no drainage noted. Then I'm gonna assess your cranial nerves 3, 4, and 6. If you're gonna follow my finger. And cranial nerves 3, 4, and 6 are intact. And this is when I'll use my Snellen chart to test vision, and this was done outside, and 20/20 vision was tested in both eyes. Then if you can follow my finger, test for conversion, which is everything's intact. Excuse me. So if you look straight, checking the eyes for pupillary constriction, it goes from a 4 to a 2. Pupils are round and reactive and adjust to light and accommodation. And if you look straight, testing the coronary reflex, the white reflex is equal in both eyes. So checking for the red reflex in both eyes, they are equal, and the blood vessels look good, and the eyes are nice and symmetric. And I'm gonna, oh my gosh, I'm gonna test cranial nerves 2. If you can cover one of your eyes, let me know when you see my fingers.
Yes.
Can you see my fingers?
Yes.
Alright, cranial nerve number 2 is intact. So I'm gonna go down to your, Alright, so your nose is symmetric, no drainage noted. I'm gonna look inside. Both nostrils are pink. The nasal septum is midline, and no polyps are noted. After that, I would assess cranial nerve number 1 and have the patient smell objects with their eyes closed to properly identify it. Next thing, I am going to palpate the lacrimal apparatus. Any tenderness?
No.
Okay, great. So then I'm moving on to the ears. I'm gonna inspect and palpate the auricles. Are you having any tenderness?
No.
Then I would perform the same on both sides. Then I'm gonna pull the auricle back and inspect inside the ear. There's no drainage inside the ear canal. tympanic membrane is pearly gray. The cona late is noted, and the handle of mouse is appreciated. So after this, I'm going to perform the whisper test to assess cranial number 8. I'm gonna say number
33.
61.
61.
And cranial nerve number 8 is intact. Then I'm gonna use the tuning fork to assess for the Weber test, hitting it on my hand and placing on top of the head so it can be heard equally in both ears. And then after that, I would assess the Rhine test, hitting the tuning fork, placing on the mastered process, and then placing it in front of the ear to assess that air conduction is greater than bone conduction. So after that, I'm going to go to inspect the mouth. The lips are nice and moist and pink. If you can open your mouth. All right. The uvula is midline. The tonsils is at a +1 grade. Proper dentation. And underneath the tongue, no lesions or nothing noticed. Then I am going to test for cranial nerve 12. And if you can stick out your tongue, move it from side to side. Cranial nerve 12 is intact. Next thing, I want to assess for cranial nerve 9 and 10. And this is when I will place the object on the uvula to stimulate a gag reflex. Alright, so then now I want to go to look at the patient's neck. The trachea is nice and midline. No deviation noted. Then I would, displace the trachea and have the patient swallow to assess the thyroid. Alright, good. Are you having any tenderness?
No.
Alright. So after that, I would palpate the lymph nodes, pre-auricle, post-auricle, occipital, tonsillary, submandibular, submantle, super cervical, deep cervical, and supraclavicular, which are not felt, which is a normal felting. Then next, I would assess the shoulder shrug to assess cranial nerve 11. Can you shoulder shruggers? Okay, great. Can you turn your neck from side to side, and then put it against my hand? Cranial nerve 11 is intact. Next thing I'm going to do is inspect the back and the lungs. So if I can have you take a deep breath. Alright, respirations are even, unlabored. Then I'm going to test for tactile firmitus. I'm going to have you say 99.
99. 99. 99.
All throughout the lung fields. And then I'm going to test for CVA tenderness. Let me know if you feel any tenderness.
No. No.
Okay, great. So then I am going to percuss. Then I am hearing resonance all throughout the lung fields on both sides. And then when I get to the, have the patient take a deep breath, I'm testing for diaphragmatic excursion. I'm hearing resonance all throughout. And then when I get to the diaphragm, I hear dullness. All right. So, next thing, I'm going to auscultate the lungs. If you could take a deep breath. I'm going to auscultate in all lung fields. Lungs are nice and clear. No adventition lung sounds are found. And then I'm going to go to the anterior chest. And I'm looking for the chest movement, checking out the skin at the same time. No rashes noted. Then I can check for any heaves on the chest, which everything looks good. And then I can palpate the carotid. Auscultate the carotid. Okay, and can I have you lay down? So I'm gonna palpate the apical pulse, and then I'm gonna listen to the hearts of the sound. The aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I will have the patient lay on their left side so I can test for mitral stenosis. And nothing's hurt, everything's within normal limits. So after this, while I have her laying down, I'm gonna look at the abdomen, look at the skin, everything's intact, no bruising around the umbilicus. Then I will auscultate in every quadrant to assess for lung sounds, for bowel sounds. Bowel sounds are present in every quadrant, which is a normal finding. Then I'm assessed for Brug's in the aortic, the renal, the iliac, and the femoral, which no Brug's are heard, which is a normal finding. Then I am going to percuss, assess for any tenderness. On the left side, you would hear dullness with the gastric bubble, and on the right side, you would hear tympany for the liver. And then I would start with light palpation, and then go to deep palpation for any tenderness, and then I will palpate the liver, and then I would see that it's at 7 centimeters, which is a normal finding, which is 6 to 12. After that, I will attempt to palpate the spleen, have the patient take a deep breath, try to palpate for bilateral kidneys, and no hepatosplenomegaly is observed, which is a normal finding as well. If you can stop. So I'm gonna assess the upper extremities. If you can raise your arms, cross them, turn your wrists up and down, inversion, exversion, spread out your fingers, close them. Everything is intact. I'm gonna test the brachial and the radial pulse, which are both strong, +2. I'm gonna look at the skin, and everything looks good, no rashes or no lesions. And then I'm going to test hand grips. Strengths are equal. I can test for coordination at this time. If you can close your eyes and put your hands up and touch your nose with one finger, and then with the other finger. All right, proper coordination is observed. I'm gonna place the item in your hand with your eyes closed. Can you tell me the item that I placed?
Paperclip.
Alright, and that it tests for stereognosis, which is correct. And then I'm gonna draw a number in your palm of your hand with your eyes closed.
3.
3, that is correct as well. Which is a normal finding. And then if you can lift your arm up, I'm gonna test for the epitrochlear nodule, which is good. And then I'm gonna check your reflexes. Tricep, bicep, brachioradialis. Alright. And that is everything else with the normal findings as well. The next thing I'm going to do is look at your lower extremities and look at the skin for any lesions, any rashes. If you can extend your legs out, put your leg in, cross them, and then put your foot up and put your foot down. Okay, that is great. And then I'm gonna palpate the pulses, the popliteal, the dorsalis pedis, and the posttibular, and the femoral. And then at that time I would palpate for any inguinal lymph nodes, which none are present, which is also a normal finding. I can be test for coordination to have your heel run down your leg, And we use that bilaterally, and coordination is good. And then I'm gonna test your reflex by hitting your patella, your Achilles. And then at this time, I would test your plantar response, which is proper. The toes are in a curling position. After that, I would have the patient stand, and if you can turn around and walk, all right, and then turn back around, heel toe, and then walk on your heels, and walk on your toes. All right, no abnormal gait is observed, and then I would have the patient bend down, inspect the spine. Any tenderness?
No.
The spine is properly aligned, and you can stand up straight, and then just bend your back backwards, and then from side to side, and then twist. Yes, and that's all. No distress or normal things found it. So then if you close your eyes and put your hands up, we're assessing for the pronator drift, and there's no movement observed. And then you can put your hands down and then keep your eyes closed, assessing for the Romberg test. No swaying is observed, and that's all within normal findings. And if you can hop on one leg, okay, then you can bend your knees to do the shallow knee bend, and that's all proper within normal findings. That completes my head to toe physical assessment.